Sometimes it's patience, so just kind of take an interest in what it is that I do and the way that I'm doing it, and just kind of want to know more about how I approach things. And so I just get in, and ultimately the whole idea is balance. So the system, when someone approaches me for help, their system is out of balance, and we have to restore balance so we can start to promote the healing process. And so each person, when they come in, literally I look at them as this massive energy that is basically turned into a tornado or a hurricane, and it's just swirling. And so what I try to do in it from an energy perspective is kind of step into that energy, or that massive swirling energy, and just slow it down. And if we can slow it down, I can see the pieces. And if I can see the pieces, I can start to pull them together and try to make it whole again if we can. And so that's energetically, that's how I try to deal with the person's physiology, is through that route. And so I stay grounded with core basic physiological functioning. So in Chinese medicine, all of your internal organs are like a large battery. They hold a charge. And I start with what are called the yin organs: the heart, the liver, the kidneys, the lung, heart, liver, kidney, lung, and assess their status and see how they're doing. And then I go to the yang organs and check those. But so that gives me sort of a core place to start with each and every patient. And if one of the major organs or more of the major organs are out of balance, they're going to start to draw energy off of other organs around them. So you've got your robbing Peter to pay Paul, you're compensating constantly. So my goal is to find the organ that's the weakest in the link, the weakest in the chain, and start to prop it back up, get it to feel better, and then it starts to feed the rest of the system. Now we've got balance. And so ideally what I'll do is send the person out and allow that to sit for a few weeks and let some of that balance stick if we can. And then we will start to move into more specific things. We might move into a disease process that's already been named, whether it's diabetes or heart disease or fibromyalgia, whatever it is. Or I might go into symptoms. It just depends on what the person needs, because we have to have always a balance between treating the symptoms and treating the true physiological causes of the symptoms. So in Chinese medicine, that's what's called root and branch theory. So the root is the cause and the branch is the symptom. So it just depends on the patient. If you have to come in initially and just go after the symptoms, you're going to have to do that. But for the most part, I try to start with, here we have the issues, let's treat those directly, and we'll also start treating symptoms at the same time.
When the patient comes in for a certain set of symptoms and you have worked with the patient and decided that really maybe the liver is the top priority, and they don't associate the liver with their symptoms at all, how do you explain to them, this is the right starting point, where they're thinking, well, no, I'm having headaches. What does that have to do with my liver?
Sure. Well, in Chinese medicine, your liver has expanded function over what we look at just in Western medicine. So when the liver is congested or having a hard time doing its job, which might be due to emotions stagnate the liver energy in Chinese medicine, which is going to lead to a liver not functioning as well in Western medicine. It will start to draw energy out of your joints and or your eyes, because the liver opens up into the eyes in Chinese medicine. If you come in with an eye problem, I check your liver first. So we treat the eyes and the liver at the same time. So that can help people understand how, in a holistic way, this is attached to that. If this isn't working well, you're going to draw from that. Does that make sense?
Yes, it does. Yeah. Where is your battle with the patients that are on the fence between Western medicine and an integrative approach? So they're still taking pharmaceuticals. How do you work with, or is it by the time patients get to you that they're done with that route?
No, nothing changes. So it's not an alternative approach. It's an integrative approach. So I look at a medication sometimes as just a crutch. And if you have a broken leg and you need a crutch, until you heal, you don't get rid of your crutch. So for instance, if you come in with high blood pressure, which is very common, or some sort of heart problem, and there are medications, we work on the real true issues underneath while you stay on the medication. And as we heal the body and start to reduce the symptoms, you become over-medicated, and we start to watch for that, and then the medications come down as you feel better. But to just walk in and think that we're going to replace one for the other is illogical, doesn't work, and it's dangerous sometimes.